Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation, and I will be your host today. Again, we have a very special guest. If you were fortunate enough to have been on last week, what an interesting discourse we had with Dr. Dayo Oluwadara, who is a dental surgeon based in Texas and California in the United States. And he gave us some basic truths that I think people really need to be aware of. The truths are that the health of your mouth, the health of your teeth and your gums play a huge role on the overall health. He was talking about things like dementia, heart disease, diabetes, and all those things that you wouldn't think would be connected to your teeth or to your mouth, but they are. And he gave some basic things that you can do, like brushing your teeth twice a day. They're going to help to minimize. I'm not saying that's the only thing, because of course, genes play a part, lifestyle also plays a part. But you cannot hope to have good health if you're going to ignore hygiene, simple, basic oral hygiene. So it's very important that we put the finger on this thing. And I think it's apt that we're starting this year talking about the mouth and the teeth because of the place that it holds in overall health. Now, as you know, we are the Brain and Body Foundation. I can tell you this, a lot of things we found out in the last 5 or 6 years of working with children with brain disorders are connected very intimately to the health of the digestive system. And we have found out that once we start paying attention to the digestive system, and of course, the digestive system starts with the mouth. Once we start paying attention to it, we find that it's a lot easier even to address brain disorders. So please, don't ignore this. Don't downrate it. Don't think it's not important. This is very important. So at this time, I'm going to say, please reach out to your friends and family, relatives, call them, text them, because we're going to go deeper into the importance of dentition, the importance of oral health with regards to the human body. We're going to take a quick break now. Don't go away. Hello, folks. Welcome back. With me in the studio, shall we say, on today's episode is Dr. Oluwadara, who is the founder and chief dental officer of Shiba Dental, based in Texas and also in California. Doc, welcome back.
You're welcome. Thanks, my friend. Nice to be here with you again.
That was good stuff you shared with us last time. So we want to go deeper, right?
Yeah, it's my pleasure. You like me to kind of make a little more comment on what do we benefit from visiting the dentist at the recall appointment?
Yeah. I wanted us to look at some concrete clinical examples, both from your experience as maybe as far back as medical school or doing your training in your practice, and some of the common things that you see in your dental practice, especially from a Nigerian perspective, that our viewers need to be aware of, so they can take intelligent decisions and make intelligent actions where the health of their teeth are concerned.
That's absolutely okay. I'll start with this. A quick recap. Twice brush daily. It's very important. Flossing at least a day, very important. And recall appointment with the dentist. Now, if you go to the dentist and in a 6 months time, they kind of evaluate you. What are the common things that might be seen? One, there might be no problems. Everything is great. You're good. Your oral health is good. Your gums are good. Your teeth are okay. Everything is awesome. That's good. The common things that is common is what we call cavities, just simple caries in the teeth in which you have tooth decay. And you see this not only among Americans, based on what I see in my practice. Yeah, while I was also studying in Nigeria, I saw tremendous amount of cavities and caries among Nigerians. And this has to do with when we do not brush frequently to eliminate sugar or any source of sugar stuff in our mouth. It could be raw sugar, it could be cake, it could be candy, it could be rice, all the common staples, all the things that we eat. When we do take that, it gets taken over by bacteria and viruses, and then they can easily work on it, becomes acid that begins to create holes and cavities within the tooth. So we call it caries. Now,
is it painful? Let me quickly ask that. Is it painful? Do people know that they have a problem with their teeth when they have this?
It's generally at the beginning of the cavity, you do not feel it. Some may have some degree of sensitivity. They can say hot and cold sensitivity, and that's all. Some may not notice anything until the cavity sleep. Let's recall the anatomy of the tooth back. In a typical tooth, you have the outer cover, which is very high, which is very white, called the enamel. Just underneath the enamel is another layer, a little bit yellow, called the dentin. And below the dentin is where the nerve is called the pulp. When the cavity starts, it starts on the enamel and gradually works its way down into the dentin. When it gets to the dentin, it's a little more sensitive. People can say, oh, I feel sensitive to hot and cold. My teeth is somehow, it can come occasionally and goes away. They kind of not really have any impact. But when the infection tracks down all the way to the nerve, to the pulp, then there's severe pain. That is one of the commonest things that you see in the dental problem. The also commonest things that you see among Americans, which I know that is also among Nigerians, is what we call general gum disease, that have gum problems, gum infections, and that can make your teeth to begin to wiggle or to begin to get loose. Those are two common things that people will see. When you go to a dentist, those are one of the things the dentist can see in your mouth, and they can advise you on what to take care of it, and ability to take care of it.
Okay, fantastic. So I remember we were talking offline before about an experience you had with one of the patients in the emergency room whose problem started with the dentist. I think she was pregnant.
Yes. Before we graduated in Nigeria, there's this patient that was an oral surgery rotation at that time at the School of Dentistry, University of Ibadan. And then there's this pregnant woman who presented. Our initial presentation was cavities on number 30, 31, 32. These are the last molars on the right side. She has great cavity that's engrossed the entire enamel, the dentin, and the pulp. On number 32 is the last molar. Then that led to pus accumulation. So there became a hole in the enamel through the dentin to the pulp, and then the pulp now trickled down into the muscles down to the extent that she now had pus all accumulating all over here. What that does, it begins to bring a situation with pus can spread all over the tissues underneath your jaw to your chest, what we call it Ludwig's angina. That's a very deadly situation. So this woman had a lot of abscess and pus all accumulating underneath here, where she couldn't breathe because there were pus all over the mouth. So we gave 100% oxygen, but she couldn't benefit from it because all the way it's all been blocked. So at that point in time, we were waiting for the ENT resident to do tracheostomy so that the patient can have oxygen through the trachea at that time, but it was too late. We lost this patient while she was struggling with her pregnancy. And why? Was simple cavity on a tooth. One small tooth cavity that can all be eradicated or taken care of if you go to see the dentist and they can just do a simple white filling called a composite filling. Or maybe in some areas in Nigeria, they must still be doing the black one called the amalgam filling. That eliminates the problem. One small appointment to the dentist will have stopped the cavity right there and there before it produces all the way down to the dentin, to the pulp, and to cause abscess. These are problems that I saw in Nigeria and that are still out there, and people need to take care of them. Now, another critical thing to look at, you can find dentoalveolar abscess in any area of the mouth, but you can also find it's particularly more dangerous in the face. We call this, if I may draw it very well, we call this the danger triangle of the face. What that means is you could have infection from there, drain all the way back to the cavernous sinus, to your eyes, and to the brain. We call it cavernous sinus thrombosis. So you could be very well today, everything is fine, with a small cavity, say you don't feel it, I don't need to go to the dentist, and within 24 hours, you land yourself in unconsciousness and in the emergency room. These are very deadly situations. I have had instances here in the United States in which just infections of the pulp can be traced back to the brain. In fact, there was one during one of my training sessions. There was a reference to it in which one of one of the professors, he told us that there was a patient that was just lost due to just infections from just root canal, after root canal therapy. So these things look basic, they look small, but they actually has impact that can not only have an oral problem, can cause a systemic problem and even lead to death.
That is scary, to say the least. So simple problems with the teeth, you're telling me can lead to damage to the brain?
Absolutely, because infections from the pulp canal can go straight to your brain.
Such a simple approach, so basic, it almost seems what's the word, simplistic. And yet it can be so far-reaching, the results. Okay, Doc, we don't want to. I know we still have to talk about some of the advances we're seeing in dental health. So we're going to take a quick short break, and then we will be right back. See you soon. All right, welcome back. Did you know that treatment of periodontal disease can improve blood sugar or blood glucose levels just by treating the gum disease? This and more we're going to keep on talking about with Dr. Oluwadara. So Dayo, let's talk about some of the tests and some of the things, advances that we're seeing in dental care.
Yes, so there's a lot of advance now, but I'm going to start from the basics. You go to the dentist, they see a little tissue in your mouth that is suspicious. They might ask you to do a biopsy. Go ahead and get the biopsy done. It could be the beginning of maybe just a rough irritation tissue due to healing. It could be the beginning of a cancer in the mouth, particularly if you maintain a dirty mouth. A dirty mouth full of microbiota is of high risk to formation of oral squamous cell carcinoma because your gums are going to be infected over and over again. You're going to be creating all factors that can lead to this. So these are high risk. Other than the fact that you probably smoke or drink alcohol, or you do what we call reverse smoking, which you do in the other. You take the light of the cigarette right into your palate, or you do some kind of bitter nuts, or take a lot of nitrosamine sauces. All of these things are risk. And in particular to other types, you can also have genetic tendencies towards that. So these are, whenever you find an unknown tissue around your gum or your mucosa, something you cannot explain, go to your dentist. A simple biopsy might just work what you need. Not only that, you could need just general investigations that we do in medicine. We call it general blood works. I'll give you an example. You could see your gums all grow big. Can you say what's growing? What's the source of all these gums that are growing? We call it hypertrophy. In other words, gums just growing big in your mouth. It could just be a sign of leukemia, which is a blood cancer. So occasionally, some of the time, a very wise dentist could be the one that would detect quickly enough that you're having a leukemia tendency going on in your body. So they can do just basic blood works to be able to see your white blood cells or the necessary culture and to be able to say, oh, this is going off or this is not going off. Or it could be a side effect of just a medication. We have a couple of medications that can make your gum grow, including hypertensive medications. So all of these basic investigations can be requested by your dentist depending on what they see when you go for your recall. If something is off, fix it on time. That is your health in your hands. Oh, it's just my mouth, I don't care about it. No, it is your health in your hands. When it's more off at the beginning, most of the time when it's caught quickly, it can easily be eliminated. And that leads me to one of the advances that's happening right there in the United States. I was fortunate to do my doctoral degree at University of California, Los Angeles. And I had one of the mentors in there. His name is Dr. David Wong. He's a big mover in research. And they started this movement what we call salivary diagnostics. In other words, most of the things we are using our blood to do, we can get to do with our saliva. Now, a lot of advances and research has shown up in that right now in terms of what benefit our saliva can do. So we're getting to a stage right now in which some of these are already showing good results. And some of these down the road in the next 5, 10, 15 years, saliva as a great test comparable to blood is likely to be on the horizon for general healthcare, in which your dentist is not just beyond a drill and fill dentist. It becomes a real source of a tremendous source of diagnostic, really a part of your essential medical care thing. Now, one of the areas in which saliva has been saliva diagnostic has been used is, I did mention, you can detect cancer early by what we call biomarkers, by some material, some liquid DNA, RNA, proteins, metabolites, and stuff that your body produces, and they get distillated within your saliva. So you can look at your saliva as a kind of a great filtrate of your body fluid. Your saliva kind of representing a filtration of your blood, of your entire body system, either in health or in pathology. So a good use of saliva right now is you can easily make it available. You don't need a prick for it. It's beneficial to the patient. The doctor himself or whoever is your healthcare doesn't run the problem of inoculating themselves when they're trying to draw blood. In the blood, they can make a mistake and inoculate themselves. Saliva is easy. You can easily collect it. It's not. It's accessible.
So just like urine, just like taking urine samples, you can
exactly. Exactly. So the advances in the saliva diagnostics right now is that they have been able to identify biomarkers in saliva that can let them identify oral cancer, squamous cell carcinoma of the mouth, lung cancer, breast cancer, pancreatic cancer, esophageal cancer.
Really?
Absolutely. Yeah. And these are right now they're developing several point of care devices in which they can test this saliva to be able to get all these biomarkers. So it has impact now in tremendous area of medicine, infectious disease. You could get viruses, hepatitis A, B, and C, fungal infections through salivary diagnostics. You can get that access. Psychiatry. Now, they'll be able to see that people with anxiety disorders, you'll be able to pick up some of these impact of cortisol and stress hormone within their saliva. What tremendous benefit that is. Endocrinology, general hormones standard within the body. You'll be able to find some of these level changes because of what you can assay out of the saliva to be of tremendous benefit. Renal, you can monitor renal rates due to creatinine levels within the saliva. So essentially now the saliva is becoming a very great tool to use. Now, I am not privy now to the level of technology we have in the laboratories in Nigeria, but this is something we should be looking forward to. We should be able to adopt this technology into the Nigerian system so that it can help us not only in the management of the oral tissues, but the overall management of the patient. And not only that's not enough, you can also measure and monitor drugs, pharmacotherapy tendencies. You give a patient a medication, you want to see the level within the body, whether the drug is being taken or not. You could assay them by using the saliva to be able to do so. So there's a lot of benefit right now as we move into the future, that a typical dentist goes beyond a drill and fill dentist, just taking your teeth, but becomes an open door to what can benefit an individual generally within your system, or to identify a disease early on time. And that's one of the most important things that is of tremendous importance, that I think our health in our hands becomes something valuable when you go to the dentist. It goes beyond just your mouth. It's actually your brain and your body being working together in that situation.
I love the way you are subtly putting in those keywords, the brain and the body, your health in your hands. When you're walking it into your presentation, thank you very much for that. Yeah. But it's true. It's absolutely true. I mean, that is fascinating that you can now begin to use saliva to detect everything from cancer to lung disease to kidney disease and all those other things. So for quite a while, as we were talking, I was thinking that, this whole fallacy that we have to have these hard divisions between different specialties and different categories, I think it's hurting us, and more importantly, it's hurting the patients and the clients that we serve. Because I was just thinking about, if the health of the teeth is so important to things like diabetes and cancer and all these things, shouldn't the dentist be a part of the management of a person with diabetes, for instance, or cardiac issues or brain issues? Surely it would make sense to send this patient for a consult with a dentist to be able to determine and ascertain whether or not there's an oral component of this disease before you proceed with doing all the very expensive, elaborate treatments. What are your thoughts on that?
No, that's actually going on right now in the United States. That's a common balance now. Most people, it's a team approach. It's a multidisciplinary approach. You see the medical doctor send the patients to the dentist and the dentist vice versa. There's just these common plans of all of those things being put together. I'll give an example. I worked on profiling biomarkers in pre-malignant and malignant situations during my PhD dissertation. And what I worked upon in terms of the pre-malignant is what we call oral lichen planus. Oral lichen planus present in the mouth, and you can see it in some other mucosal aspect of the body. You can see it on the skin, you can see it in the vagina, in most of the oral offices. So you see dentists working together with dermatologists. Not only that, we find a lot of autoimmune situations right now that involves the mouth and the skin together. And some of the time, the first spot to first identify most of those instances are within the mouth. So these are vesiculobullous lesions. In other words, you have, let me kind of break it down for layman's understanding. You have a little growth, a kind of a fluid circle growth within the tongue. It could be on the tongue, it could be on the mucosa, it could be on the lip, like vesicle forming. Some of them can a little more expand, called bullous. So we call them vesiculobullous lesions. These are mostly autoimmune diseases. Some of them first present within the mouth. When the dentist identified, along with the oral pathologist, after some immunofluorescence, then they send the pathologist in. So gone are the days in which it is my mountain, not your mountain. Right now, it's a crosstalk in terms of multidisciplinary approach, in terms of management of the patient. And as I said, I have had patients being referred to me several times, which they have a lot of colon problems, colon infections within the GI, and their doctors just sending them, their cardiologists also just sending them, go to the dentist, take out all your bad teeth and infected gums. And so I think that over and over again. And I hope that's already existing in Nigeria. And I hope it's a kind of attitude that is encouraged among professionals across the healthcare system within the Nigeria.
Awesome. For such fascinating stuff. Thank you again, Dayo, for taking the time to share this information and this wisdom with us. We have come to the end, unfortunately, of this our short episode period. But any final words you want to share with us before we end this?
I would like to emphasize again, your health in your hands. You know your body. You see something wrong, say something. Go to your dentist. Take the next step. Every little step matters. And when you nip it in the bud quickly, then it does not progress to more conditions that can affect your life and cause death. Your health in your hands.
Truer words have never been spoken. Thank you very much for that. God bless you, sir. Have a great 2022, and hopefully we'll have you back on the show several more times.
God bless you, Dayo, and again, congratulations on the award.
Yes. All right, folks, that's it. I hope you enjoyed that episode. Please call your family, call your friends. The videos are available free of charge on our website, brainandbodyfoundation.org, and on the NTA YouTube site, NTA YouTube. You will see these videos archived there. Please watch them. Please share them with your friends and family. This is very important. It could save lives.